Hello everyone, Assalamualaikum. How are you? Today we're gonna touch about the topic, are you having nerve problem or bone problem? And at the same time also, we often heard actually from the elderly about homesick. But what actually does it mean? To talk more about this today, I'm right here at Gleneagles Hospital Penang, where I'll be accompanied by the rheumatologist consultant, Dr. Tan Bee Eng. How are you, doctor?
Great. How are you?
I'm great, thank you.
Hello everyone, I'm Dr. Tan Bee Eng. I've been treating rheumatological patients for the last 20 years.
20 years, huh? Doctor, would you mind to share actually how to differentiate RA or known as rheumatoid arthritis with different kind of form of arthritis?
So before we talk about arthritis, I need to explain what is arthritis. So arthritis is an umbrella term describing disease of the joint. So what do you mean by joint? Joint is a place where bone and bone meet. Okay, so this is the picture of the joint. Okay, bone and bone meet. So the main function of the joint is for us to be able to move.
Correct.
Right. Yeah. So the joint is protected by cartilage at the end of the bone, and also the membranes that produce the oil. You know, the lubricants.
It's like our car lah.
Our car.
Correct.
Yes, yes. And surrounded by surrounding tissue to protect the joint. When we talk about arthritis, it means the inflammation of the inside purple area. So how is rheumatoid arthritis different from other arthritis? I believe that everybody knows about osteoarthritis, you know, the arthritis affecting elderly patients.
Yes, correct.
Characterized by, you know, wear and tear of the disease. And the other one is gout. Patient with rheumatoid arthritis, the hallmark of rheumatoid arthritis is actually inflammation.
Correct.
What caused the inflammation? Is because of the immune system. Our immune system is supposed to protect us. It's like an army.
It's like a shield.
Yes. So when there is outside the bacterial virus, our body produce cells and antibodies to fight.
Correct.
And we recovered. But in a patient with rheumatoid arthritis, they are confused. Our immune system is confused and it attacks our own body. And in the case of rheumatoid arthritis, it affects the joint, but it may also affect eyes, the skin, and the lungs. Patients with rheumatoid arthritis, they can affect many joints. You know, in fact, basically joints of whole body.
Wow.
As you can see here, the one marked red here. Okay.
So this is where you might easily get affected by the rheumatoid arthritis.
Yes, correct. Basically, it's almost all the joints in the body. Yes.
Correct.
Okay. So rheumatoid arthritis can be divided in a few phases. So in the early phase, intermediate phase, and advanced phase. So the difference is also about the age the patient may get.
Yeah, sorry, before that, doctor, when you talk about the age, right, I just wonder, other than age, just out of curiosity, for both male and female, men and women, who have higher risk to get affected by rheumatoid arthritis?
It's female.
Oh.
So, yeah.
Okay.
So, if I have 10 patients, 10 newly diagnosed patients, among the 10, 7 or 8 will be female.
Wow.
Yeah. So in osteoarthritis, it's mainly more advanced age group, like above 40, and when the patient gets older, the risk is higher. Okay. Yeah. So whereas in rheumatoid arthritis, the disease can affect children and elderly, but the peak age of rheumatoid arthritis is actually 20s to about 50s.
Doctor, just wonder, actually how you detect or how would you know that you're affected by rheumatoid arthritis?
A patient with rheumatoid arthritis will have the following symptoms, like pain, which is worse in the morning, stiffness, joint stiffness. So, and the stiffness is usually very prolonged and is worse after prolonged immobilization. For example, after sleep. So when they wake up from sleep, they have severe stiffness which can last for hours. Okay. And then the joints can get warm and they have difficulty in functioning.
So meaning that your daily movement might be limited as well lah.
Yes.
What kind of patients, or should I say RA patients, would face deformities?
Okay, as I mentioned earlier, in rheumatoid arthritis, the characteristic is inflammation.
Correct.
Think about inflammation as fire. It's a fire in your joint. So, if there's ongoing fire, it will eat into the joint and causing erosion of the cartilage and joint, and with that, it can cause deformity. So the function is to put off the fire. So when you put off the fire, the symptoms gone, and there would not be progressive deformities.
So by any chance, like if somebody being affected by rheumatoid arthritis, by any chance, even slight chance, he can be cured?
Okay, don't sound so pessimistic. Rheumatoid arthritis is treatable. Think of rheumatoid arthritis like diabetes and high blood pressure. So they are totally treatable. Okay. So especially they can treat to totally normal if you catch them early, diagnose early and treat early. Yeah. So we have various treatment targeting in different way. So many of these patients, they can continue normal life, and this is the objective of our RA treatment. Yeah. So when we talk about treatment, it can be we are talking about for years.
Yes.
Same like diabetes and high blood pressure, right?
Yeah.
Right. Yeah. So the good things about rheumatoid arthritis is after some years of treatment, so when the fire is totally put off, we can slowly cut down the medication. Yeah. In some patients, especially if you diagnose and treat them early, about 5 to 10% of the patient can be treated well and tapered the medication to zero.
As you mentioned way earlier, your body is your boss, not doctor is the boss, right? So each patients, they have their own body condition.
Yes, I told patient, your body is the boss. I'm not your boss. So we taper the medication, treat the medication according to the body response.
Dr. Tan, thank you so much for your time joining us.
My pleasure.
Yeah, to share about the topic of the day. And I know you're super busy, so it's our honor to have you.
Thank you.
Yeah, to all our dear viewers, we hope that you have quite numbers of handful insight about rheumatoid arthritis, and hope to see you again, and take care. My name is Faiz.
And I'm Dr. Tan Bee Eng.
And see you. Bye-bye.
Bye.